Welcome to ALBIN Excellence podcast, the series where Swiss medical entrepreneurship meets world-class surgical expertise. I'm Lou Albin, CEO of ALBIN Group, and today my guest has dedicated over 2 decades to redefine what precision means in plastic surgery. He developed his own facelift technique, he analyzed his own work after 10 years, and he teaches surgeons across 4 countries like Switzerland, France, Spain, and Italy. I'm happy to welcome Dr. Giuseppe Colombo. Welcome.
Thank you, Lou. I'm proud to be here with you and discuss something about the activity, the role of plastic surgery in the society, and in general, how it's possible to increase the value of this fantastic branch of medicine.
Giuseppe, your career is defined by extraordinary depth of academic commitment. You graduated with the highest possible honors from the University of Genoa. Your clinical fellowship took you across Brussels, Geneva, Lyon, Nice, Spain, and Italy, and you hold leadership roles across 5 institutions. You have published over 30 peer-reviewed papers, which is a lot, 10 years revision analysis of your own work, and you hold a dual board certification in Switzerland, such as Italy. You have organized over 30 international cadaver workshops since 2010. Giuseppe, a lot of work, a lot of commitment. What drives you to go into such depth?
Look, Lou, it's very easy to reply your question because I want to use the words of my grandfather. He worked a lot and in every single step of his life show me that if you want to do something, you must to do in the better way that you know. And then I put myself in every single aspect of my life, in particular in the study during my university and afterwards during my specialization, and I continue to try to give my best. For sure, it's very difficult because I spent a lot of time follow my research and I cut many times with my family, but I have a special family with a fantastic wife that cover me and support in every single aspect. But if you want to realize your dream, and I think that you must spend your life to build every single aspect of your dream. And my work is my dream.
Mm-hmm. And also when you studied medicine, your first steps were about biochemical, right? And
look, I studied medicine, and afterwards I studied to become a plastic surgeon and specialized board certified plastic surgeon. And then afterwards I decided to study for philosophy doctor PhD in biochemistry to understand the whole system of our industry, because you know that we use the breast implant, we use the injectables, and then the foundation of these 2 markets are for sure inside the biochemical vision. Then for me it's important to understand the mechanism that they cover these 2 important fields of our practice.
So first it was the biochemical degree that you studied, and then the biochemistry, right?
Yes, biochemistry. After the board specialization in plastic surgery.
Does the biochemical foundation change the way you see surgery today? And if yes, how?
For sure, because not only for surgery, but for injectable in general, because the biochemical vision gives me the possibility to understand, for example, the mechanism that work to create a biofilm around the breast implant when you use, or for example, the problem related to the last nodules that appears in the face after 1 year, 2 years that use the same injectable. And biochemical vision, biochemical study give me the reason, give me the foundation to treat, to understand, and how to solve the problem in this case. For example, in our case, when we discuss about the breast implants, we know that if you don't use the perfect system to introduce the breast implants or to create a perfect pocket around the breast implant, the risk is to have a microfilm are surrounded that breast implant, and this microfilm is a humus for the next generation of bacteria that increase the risk of contraction of capsula.
Interesting, and we will also discuss also more about breast surgery on a later stage of this podcast. One of your mentors, or some of your mentors, was, for instance, Professor Giovanni Botti from Italy and Professor Tapia from Barcelona, who is also faculty member in over 30 countries across universities and scientific societies worldwide. What did you learn from Professor Tapia from Barcelona and Professor Botti in particularly? How did both professors shape you today?
Yes, look, I spent a lot of months with Giovanni Botti. He's a fantastic surgeon and a beautiful, kind person. At the same, I spent 2 years in Barcelona with Tapia. The first message, that my take-home message from them was to be a honest doctor in front of our patient, because if you handle the knowledge, the second step is to stay always honest during the process, at the first consultation to the end of operation. This is important, and Giovanni Botti is a fantastic person. Tapia died 2 years ago, but he gave me really a game changer to approach this spectacular branch of medicine, because it's very difficult to be a plastic surgeon today, because I don't understand if the market guide our choose or the doctor guide the market. My opinion is to continue to be always a doctor and try to guide the market. The market is the second option, is not the way to do a perfect consultation with the patient. Then I follow the words of Antonio Tapia: please, Giuseppe, respect the people that you have in front of, and then you became for sure a good doctor.
When you have been working with them together now, for instance, today, we will also talk about cadaver workshops and what you're lecturing, but was it also something that you learned from them that you would like to teach other doctors, like you're teaching them in cadaver workshops? Was that something that inspired you, Professor Tapia or Professor Botti, to go in this way about teaching others about cadaver workshops?
Yes, for sure. You can imagine that I spent 2 years in Barcelona with Tapia, and he teach every single aspect, every single tips and tricks in his work. And then when I develop this way, I try new things, I publish new things, and I organize the cadaver lab, because the cadaver lab is the secret to share your knowledge without any risk to the other doctor. And then they can perform surgery full of knowledge in their private clinic.
When you could mention one thing that Professor Tapia taught you, what would it be?
It's very difficult, because it's a mix from knowledge and humanity.
And with Professor Botti?
Same thing. Same thing.
Yeah. Okay, wonderful. I would like to discuss with you about the Koru and the VIPS technique, because Giuseppe, you have spent over 20 years studying the SMAS, the superficial musculo-aponeurotic system, which is the deep facial layer responsible for the descent of the cheeks, of the jawline, the nasolabial folds, and the jaws. From your mastery of the SMAS, you developed then the Koru lifting technique, which you have published in the National Library of Medicine, validated in 31 patients between 2010 and 2012. And more recently, you have also developed your own technique called the VIPS. And my question is, can you please explain in terms the fundamental differences between the standard SMAS surgery and the Koru technique versus the VIPS technique? What is the difference for me, who is not a doctor, or to those doctors who understand that better, between SMAS, Koru and VIPS?
Yes, I start to perform face surgery from 2008, and I use all technique that I study and I observe from my mentors. Then I try to develop a simple technique. Coro technique was a technique that I developed with my close friend many years ago, and this technique is very simple for the beginners. Then after many years I developed another technique, VIPS technique. This is more complicated. It works on the superficial musculoponeurotic system, try to lift without dissect this layer. And I think that they work very well. The difference is that the first step is for the beginner is Koru technique, because with this it's possible to lift and to maintain the results for many years. The VIPS is more articulate technique and not for beginners, because in this technique I treat the SMAS in the neck called platysma in different way with a deep dissection. And how I can describe this, and I describe not only for beginner, but depending for the anatomical shape of the SMAS in front of me. When I visit the patient, I decide the technique, but I use not only these two techniques. Really now I completely forget Coro technique and I prefer VIPS technique because it's more articulate and complex at the same time with best results. But I use, for example, deep plane face lift, high SMAS, low SMAS, depends. There is no technique for all face. There is no technique for all breast. There are many techniques. It's important for doctors to handle whole technique and decide not because the market wants this technique, but because you choose with your honesty in your heart and your soul and decide the best technique for my patient in general, for the patient of my colleagues.
Is there an ideal patient for VIPS? Is that something who has to do about age or skin laxity? What is it exactly? What makes it that you can choose between a SMAS and the VIPS?
Yes, with middle ptosis of the tissue, because when you are in front of full descent of the tissue, it's important to stay more aggressive to achieve results that it lasts many years after the surgery. The VIPS techniques work for the middle age, for the middle ptosis of the face, for the patient ideal from 55 years old to 70. It not with big face, but a good face with a middle grade of descent.
Yeah, of sagging. Yeah, okay. And surgeons in Europe who are watching this podcast, who would like to attend, for instance, such a course, a VIPS course, where can they, prescribe, or where can they find you? Is there a webpage where they can, how can they reach you?
Look, I publish my technique on PubMed. This is very easy to have an access. This is important to share my idea. But during my course, I teach all technique because I don't want to create a show for me. I want to create a foundation of knowledge for my colleague. This is my way. I don't want to create any marketing about my vision. I want to create foundation for my colleagues. My workshop, my cadaver lab are create a foundation, a basis for the other colleague from anatomy to the target, to the results. But I don't discuss exclusively my technique. It's no sense. I want to share all technique if possible. And if some colleague want to do this technique, they can come in my private clinic and show the technique. If I perform in the case that I have this day, or read on paper.
So that will be in the Ticino, in Canton Ticino, then, where they can learn this?
Yes. I work in Sant'Anna Clinic, a beautiful clinic in Tessin. My opinion is one of the best clinic worldwide, and I love the colleague, I love the staff, I love the director. It's very beautiful clinic, and there I can perform easy with a perfect environment surround me.
So they can also go through your webpage and contact you then directly?
Yes, because in every single session that I perform surgery, not only face but breast, I can guess one doctor. He can come without any payment because I never pay to observe Giovanni Botti on Tapia or the other doctor that I visit worldwide. This is, for me, it's very important because sharing the knowledge is not marketing, is not by payment. Sharing the knowledge is the law. If you are a good doctor, you are a good doctor, then they can come, they write me, and they can come when it's possible, when we have space to guest my colleague.
Which is also unusual because you like to show your experience, right?
Yes,
and
yes.
Because in other cases sometimes they have to pay for every course, etc. This is
look, Albin. I was lucky because when I asked to Giovanni Botto, you can imagine, I spent 2 years in Barcelona with Tapia. I never pay. I remember my first step. I wrote a mail. Please, I read your article on PubMed. I love the way that you approach the face.
And you teach me that, yeah.
Yes, I can come for sure. Come, my clinic is open for you. This is my way. For sure, the Cadaver Lab is by payment because there are lot of course. A lot of things around that I must pay to organize, but my clinic is always open for my colleague, my dear colleague.
Yeah, we will also show your contact details then on this this podcast so that they can contact you directly. How long does it generally take to feel safe performing a facelift independently? How long does it take? Is about your experience?
Look, I repeat, I spent 2 years in Barcelona to try to understand the tricks of this beautiful surgery. Then I spent another year in the Cadaver Lab in Nice to understand layer by layer what I can approach safely the face. And I discuss currently in the last Congress with my close friend, the border is this. If you perform less than 30 surgery, this kind of surgery per year, please don't perform this surgery because
by yourself,
the problem is not to perform. The problem is to handle, to manage the eventual complication.
Exactly.
Then less than 30, please don't try.
Or you have someone who is professional like you next to him who can teach you or teach him how to do it.
Yeah. And you can do together.
What must a surgeon have in place before operating with your special VIPS technique? Does he have to learn first the SMAS before he goes to the VIPS? Or, I mean, you told me that you are teaching everyone different kinds of techniques during your courses, but what would you suggest them? Start small. I mean, start with the SMAS and then go to, let's say, another technique, or what would you suggest a surgeon?
Okay, when you approach the face in general, or for example the breast, start with easy technique, then increase the power of your technique, then arrives till the end. But remember that in medicine, and in particular in surgery, you don't know where is the end, where is the border. You every day discover something new. Then it's no sense to approach, for example, the face with the deep layer because you risk a lot. Starting with plication, with max lift, for example, or easy dissection. Then, step by step, you increase your knowledge, you increase the power of your hands and your mind, and increase the possibility to handle every single technique of the face.
Talking about revision and scientific honesty, you did something very rare. You published a 10 years analysis about your own revision cases.
Of breast augmentation.
Of breast augmentations. And that requires a specific kind of honesty, which is, in my point of view, quite uncommon in plastic surgery. And what motivated you to go back and analyze 10 years of your own revision work?
Look, Albin, we discussed at the beginning, it's important in your life to observe the past, to build the future. Then, after 10 years, I decided to revision my breast implant under the muscle, behind, over the muscle, behind the fascia. And I tried to make an average of complication, of good results, because it's so important to grow myself and give the best for the future to my patient. This is important step. If you don't observe the past, it's impossible to build a beautiful future. And in my cases, the perfect future is related to the perfect achievement for my patient.
Talking about your 10 years reviews of data, what was the most important insight you discovered from your own data?
That I started to put the implant, for example, behind the muscle. After 2 or 3 years, I decided to put, not in all case, but in many cases, around 95-97% over the muscle behind the glandula.
Okay.
This was my game changer. And after 10 years, I think that this way is very good. And if you read now the currently paper on PubMed, you observe that many colleagues worldwide use the technique behind the glandula and not
glandula
to
then, yeah.
yes, and not to move the whole the whole pectoralis majors, gran pectoralis.
Yeah. And that was, let's say, a self-analysis that you did as a development of your technique, then also, but it depends also how much glandula she has, etc.
Yes, for sure. We discussed previously, there is no technique for all patient. We are in front of the patient with a particular anatomy, with a particular shape, then we can discuss and we can find the best technique. But after 10 years of experience, I understood that in 97%, if you change the shape and the dimension of your breast implant, you can cover the approach behind the glandula and not behind the muscle.
Okay, wonderful.
But this is my personal opinion.
Yeah.
And you can imagine that you don't destroy the muscle, you don't move the muscle, and the recovery is very fast.
Yeah. We are now by the end of session first, and then we are coming back on the second session. We will just do now a shortly break. Thank you very much for your answers so far, and we'll talk then soon later.
Thank you, Lou.
Giuseppe, let's talk about, in the second part of this podcast, about 2 countries, 2 patient cultures, 2 dual board certifications. You hold a rare dual board certification, the FMH in Switzerland, and also the Italian board certification in Italy. You operate in both countries, in 2 distinct healthcare cultures. How do Swiss and Italian patients differ in their expectations culturally, aesthetically, and emotionally? And what does that tell you as an international surgeon?
Good question, Lou. Try to be honest. In the global market, because we are in the global, everything is global now. Yeah. It's very difficult to divide the patient from Italy or from Switzerland. My opinion is this, that the patient are the mirror of the doctor. If you are a good doctor, quiet doctor, easy doctor, with a simple expectation, but look, this simple expectation doesn't mean basic expectation, but realistic approach, realistic expectation. Respect the shape of the patient, because the trick is the plastic surgery works to improve your quality in general, your shape, to build your confidence. Then I don't find the difference from Switzerland to Italy, because I am this kind of doctor and I try to respect the shape of my patient without any dreaming to rebuild the face, because it's no sense, because the face is the mirror of the soul. Then the patient are the mirror of the doctor. If you work in this way, you receive this kind of patient. If you work in Italy, the same. If you work in Switzerland, the same.
Yeah.
It's important not to follow the global moods, the wave of fashion. Look, ALBIN, for example, we are in front of this global market. There are many cases of brand that stay on market 2-3 years with very aggressive
marketing,
and then they disappear completely. But Giorgio Armani or Salvatore Ferragamo, they start in 1970 and they continues to be a king of market. My opinion is this: if you are a good doctor and you work exactly close to your patient to build the confidence and not to build the monster, you receive this kind of patient. And there is no different from Switzerland or Italy or USA or South of America. The patient select the doctor related to their dream. And I want patient with real expectation. And I offer this.
Yeah. Do you see then also a difference? Now we have been talking about the side of the patients, but do you see any differences between the Italian and the Swiss doctors, in generally speaking? I mean, in views of surgical techniques.
Another good question.
Yeah.
Allora, look, Italian doctors are very strange because if you work with top-level doctor, you don't know any movement of jealous between us. If you start to talk with medium level of doctor, it's incredible.
Different.
But yes, yes,
which is strange, huh?
Strange, because they want to show them off as a king, but it's not necessary. If you work well, if you are full of knowledge, it's not interesting to show yourself. Not need, because the other doctor know who you are.
Yeah.
The Switzerland is completely different because, for example, in my operating theater, I have many colleagues from the operating theater close to me. Then it's fantastic because they want to increase the knowledge. And they want to discuss the facts, the evidence-based medicine.
They want to learn and ask questions.
Exactly. I think that in this case, Switzerland wins because the culture is for all.
So they are more open-minded, do you think?
Yes,
and they have no
so.
problems to ask questions, and...
Yes, yes, exactly. In Italy, many doctors work. This is my garden. I am greenkeeper of this garden. I don't want to share with you, but the medium on the low level. If you discuss with top level, no. This is my garden. Please enter and see. In Switzerland, I really, just to be honest, I think that the doctors are open without any limits, and I think that is a fruit of the culture.
It's a very interesting point that you
Switzerland is a melting pot.
Yes.
There are 4 languages in the same country. It's a melting pot.
A good benefit. But it's interesting that you said this. Thank you. And let's talk also studies and lectures. You have currently been working on a review about 1,000 cases of breast augmentation, and you have been talking a little bit already in the first session of the podcast. But what makes your study, from your point of view, truly special? What makes your studies truly special?
About this work?
Yeah, of the 1,000 cases of breast augmentation.
We discussed before, it's important in your life to stop 1 second and study the past to build a perfect future. Then I stop, I revision my case, and I try to give the best results, what I observe. This technique works very well, then I continue to use. Or I have this 100 case that I use this, but with different shape of breast implant. Then I can mix for the future. This is to try to offer the best results for the future. It's important to observe your past work, your previous work.
So, Giuseppe, I'm also wondering what distinguishes your study from other large-scale analyses in breast surgery. What do you think is more specific about your study?
No, look, Albin, I decided to publish this article, but I read many articles in PubMed that show my same conclusion, my same target, that now we are in front of a new approach for the breast implant. Not before 5 years ago, all implants are behind the muscle. Currently, if you check on PubMed, the last version is try to avoid the approach behind the muscle, but try to implant behind the glandula. And my article discussed this and showed this after 1,000 cases.
So when a colleague reads your study or others, what you like them to understand one benefit of your study? What do you think would be most important for them to understand in breast surgery?
Yes, that my article for the other article in the scientific literature, that is a game changer, a shift from technique to implant all breast implant behind the muscle to over the muscle. This is the technique, but it's important to study the patient, the shape of the breast of the patient, the anatomic condition of the patient, and then choose the best implant. And now you can imagine that you know very well that we are in the era that the market offer different shape of a breast implant, different cohesivity gel inside, different texture, and compared to 10 years ago, we have completely shift our thinking where it's important to put the breast implant, because now we have an offer of implant completely different compared to 10 years ago.
We will also talk a little bit more about breast implant itself by the end of this second session. When we talk about training, education, and cadaver workshops, I know that you always have colleagues in your operating room, and beyond that you organize a remarkable number of training courses in surgery, in aesthetic medicine, and especially in anatomic cadaver dissection. Let's discuss about your 30+ international cadaver workshops, which you have organized in Italy, in France, in Spain since 2010. For my next specific question, Giuseppe, I would like to mention none other than a genius in my eyes and all over the world the same, named Leonardo da Vinci, who revolutionized art through his anatomical studies, for which he dissected over 30 corpses in private cadaver workshops. They were not public, they were private because he did it a little bit more hidden, during the years of 1490 and 1513. So incredibly 513 years ago. So he studied muscles, tendons, organs in great details in order to achieve the highest artistic precision for his arts and to understand the anatomy of human body. My particular question, Giuseppe, why are cadaver workshops so important, also over 500 years later than on Da Vinci's time?
Yes, look, Albin, I am a founder with other two brilliant colleagues of Accademia Anatomica, and I use as a symbol, as a drawing of Leonardo da Vinci. Yes, the
uomo
vitruviano.
Exactly, I know which one. Yeah.
Look, why is so important to have cadaver lab? Because it's impossible to build your career without any foundation. And for the surgeon, the foundation is the anatomy. Yeah. If you know the anatomy, you can build your career safety. Then, if you know the anatomy, in our cases in plastic surgery, you can build not only the career, but the perfect results, because the anatomy drives the shape of the face, the position of the ligaments, the position of the muscle, the same way the ligaments of the breast, the shape of the breast. Then, if you know the anatomy, you can drive the patient to achieve the best results. It's impossible for surgeon to perform surgery without any correct approach to dissection cadaver lab. This is the first step. After your studying, it's important to enter in the cadaver lab, in the wet lab, to try to simulate the surgery, the hands-on, and then you arrive at the end on the patient. If you, from university, you arrive directly to the patient, you lose some aspect and you risk a lot.
I can imagine that. And these cadaver workshops that you are organizing are extremely demanding. I can just imagine physically, time-consuming, and also in terms of organization. What drives you personally to take this workload every time again, time and time again, and what motivates you to lecture now other colleagues in anatomy?
What is important for the medicine in general? To leave something special for the next generation. Mm-hmm. This is my reply for you.
Yeah.
And if you want to leave something special, the anatomy is the foundation for everything for doctors. Mm-hmm. Then I spent a lot of time out of my family, out of my house, but at the end when I finish my masterclass on Cadaver Lab with my two colleagues, we are happy. We are happy because we see the face of our colleague full of energy, and this energy entry in our heart.
And it gives you the satisfaction about helping others.
And when a colleague arrives in his private clinic after 2 weeks, after 3 weeks, and send email or message, thanks a lot because I performed the surgery that I see before in your clinic and after in your private masterclass. For me, this word changed my life.
This is kind of a philosophic also way how to see the things, because one of my questions would be, what drives you, fundamentally distinguishes you about cadaver workshops and philosophy, but you told already about the satisfaction, knowing that you give lecturing and your experience to others, and it gives a good feeling, and for others, they are thankful to join your cadaver workshops.
And look, I want to say this. If you teach the colleague in a correct way to respect the patient, starting from foundation, starting to the anatomy, and respect the health of patient, the money of patient, for sure what do you attain? Not only increase the knowledge of this colleague, but the value of plastic surgery worldwide. Mm-hmm. Because now because you know that plastic surgery is under control of market. Mm-hmm. But if you teach that the rule of plastic surgery is in the hands of surgeon, you change the vision and you increase the value of this beautiful branch of medicine.
Mm-hmm. We have been talking about Da Vinci's time 513 years ago when he performed his own private cadaver workshops. We talked now about your cadaver workshops that you are organizing recently, right now since 2010 till now,
yes,
and are still continuing to do it. How do you see the future, let's say in 50 years? What will the medicine looks like about also? Do you think that there will still be cadaver workshops also in 50 years? How do you think the market will change about this for the next generation?
The anatomy is always the anatomy, and we will be always the anatomy. Then I think that the power of the courses for sure increase during the next 15 years. For sure, we have many tools that we can use, for example, AI, and then it will work very well, for sure. But it's important for surgeon, for doctor, to touch the real condition of the tissue, because it's beautiful to see on iPads. Mm-hmm. It's fantastic. When you stay on bed, you can read this anatomy. Oh, yes, I go through inside the brain, go through inside the breast of the cell. But it's fantastic, for sure. But the operator, you are the operator. That it's important to touch the real condition of the tissue and the position of the muscle. We can combine, for sure, the future, you can combine the benefit of
technology, whatever, but you have to do the hands-on also on, let's say, cadaver first, and then, let's say, patients second. Yeah, okay. So also when surgeons from Europe wants to attend your cadaver workshops, there will be organized in Italy?
Yes.
Yeah.
Because there are not a lot of places where it's possible to organize. Mm-hmm. For example, I start organizing in Nice, France, then in Madrid, and now I move completely my activity for Cadaver Lab in Verona, in Nicolo Center. It's a beautiful, it's a strange work for Cadaver Lab, but okay, it's a perfect place because the quality of the service is so high. And then if you want to to teach in the best way, you must have the perfect specimen. And ICLO give us the high quality.
Yeah.
And I choose this location for this.
Yeah. So also in the future, if someone wants to attend, they can go through your webpage. We will also show your contact details then on this podcast, but they can go through that and ask for the next cadaver workshop when it will be.
Look, you can imagine the importance and the value of this cadaver lab, not because I develop my academy, this is not interesting for me, but you can imagine that I full booked till 2027. I have no space.
Really?
And this is for me is fantastic.
Incredibly.
Yes, incredible, but means what?
Yeah.
That the other colleagues believe in my offer,
Of course, yeah.
believe in my work.
Yeah.
At the same time, I am so happy because I am on the right way.
How many spaces are, do you have or offer for, let's say,
Depends. For aesthetic medicine, 20 doctors. For surgical course, only 12. Because it's no sense to have a full house and you don't follow a single doctor. Yeah. We are in 3 in academy. We are 3 doctors in academy that we grew together during this time. And every single doctor that spend time with us is followed from the beginning to the end and perform every single injection or every single kind of surgery in the face.
Whatever then.
Yes, it's no sense to have a full house with 50 attendants and then no one learn very well. I prefer to have more courses but with small group. This is my way.
Okay, yeah. And how long does a cadaver workshops last?
2 days.
2 days?
2 days, full.
Okay. Yeah.
2, maximum 3 days. Because you are destroyed at the end of the day.
Yeah, I can imagine. But you do cadaver workshops for, let's say, injectables, but also for facelifting and
3 different kind. Injectables in the face, breast surgery or face surgery.
You do also for breast surgery?
Yes, for sure, because it's important for the attendants to choose the perfect plane. You are behind the muscle, yes, but have you touched the posterior fascia of the glandula or you are in the Chassignac space, for example, the space between the fascia of pectoralis major and a deep fascia of glandula, or you are in the between and you are behind the muscle or in the deep fascia of pectoralis major, then it's important to see the intercostal branch of artery, of mammary artery. Then for the access, for example, entry point in the axilla around the nipple areola complex or in the inframammary fold, it's important for the attendant to choose the best way and to practice, to do this approach. What do you see when you open the scar? What do you see? It's completely different if you enter from the axilla or if you enter in the inframammary fold. Then, for the breast reduction, it's important to design before surgery, and we teach this. We have two courses during the year dedicated exclusively for the breast surgery.
But now I'm a little bit unsure about, are you then performing that on patients or on cadaver? That I'm not sure about now.
On cadaver.
On cadaver itself?
Yes.
Okay.
Three type of cadaver courses.
Yeah.
For injectables, toxin, fillers. Second, dedicated exclusively for the breast surgery, augmentation, reduction, PEXIS, and face surgery.
Because this is something which I would love to see one day as well. Yes. I have been attending also twice, I think, a cadaver workshop of facials. It was very interesting. Once was also for the carpal tunnel, but I have never been attending a cadaver workshop for breast, and I think this is something we can.
It's not easy to organize because we
can imagine.
We asked to our service ICLO in Verona to have a perfect breast. And it's not easy.
Yeah, I can imagine. Well, it's super interesting, and I think we will discuss more about that in the future. How do you see innovation AI for the future? Our industry is developing rapidly. AI-based imaging tools are entering the consultation room. New techniques emerge every year, and with that evolution comes new risk. not just clinical but also perceptual. How do you see AI imaging tools changing patients' consultations? Do they help manage expectations, or do they risk creating unrealistic ones?
There are two aspects. The first one, for example, for the other colleague, we discussed before, AI works very well because you can study in a beautiful, for example, on your iPad during the night and combo with dissection cadaver lab. For the patient, EA works very well during the first consultation, but it's important to understand that EI is guided by the doctor, by the man, that you can create the results that you want, but not always these results correspond to
the
real life. Then, dreaming is for free, but remember that medicine is a science, is not a dreaming.
And it takes
then,
time to learn.
With in artificial intelligence, you can create what you want, but it's important to understand the limit, the border of this technology. For sure, it works to help us, but it's important to know the limit and to teach our patient that this is results that is possible to achieve. This is dreaming.
Breast surgery is worldwide a significant part of most clinical portfolio, a domain where the technical aesthetics and psychological stakes are, among other surgeries, exceptionally high. You have been deeply rooted in breast surgery for many years and have performed countless procedures. When you look at the evolution of the field today, what do you believe has fundamentally changed the most in breast surgery?
Now we have in the era where it's possible to choose really a lot of implant. We are in front of a big offer, different shape, different cohesive gel inside, different surface. Then the role of doctor becomes so important because the doctor play a role not only to choose the shape, not only to guide the patient, but to choose the best, for example, in a portfolio of ZC Aesthetic, how many implants do you have? And the rule of doctor is this, to choose the best implant for the patient. There is no best implant for all patient. There is custom-made surgery. I think that is the future of the breast implant. Now we have in front of many choose in front of us because there are different kind of breast implant. The future related to the breast implant will be a customized operation. The patient with doctor decide the shape, the dimension, the surface, and every single aspect of the implant. This is the next future, thanks to AI.
That's an interesting point. And so you think that the specific characteristics can be also done in the future due to different kinds of models and shapes, and this is something that you think will come in the near future?
Yes, for sure. You can imagine that we have different implant, for example, for the face, for the middle face, for the chin, and you can ask to the company, please, I want this implant with this measurement, with this topics, future characteristic. At the same in the next future, we can discuss with the company, I want this breast implant with these topics for this kind of patient. The future related to the breast surgery for sure is customized, completely customized approach.
How important is, when you talk to your surgeons, the topic about ALCL?
Yes. It's important to explain every single risk for the patient. This is important. For sure, for example, in your case, you don't have any case of this disease related to the Pearl or to the Luna. But it's important to discuss with the patient the possibility to have. For sure, the average is nothing, is close to 0%.
Exactly.
In front of, compared to the number of the implant that the doctors use during 1 year in the world.
Correct.
But it's important, as it's so important to discuss this possibility to destroy the implant? Yes, 0.00, but it's important to teach our patient. The same, the contracture of capsula that surround the implant. It's important that the patient know the adverse reaction, because the right way is you have the breast that you desire, you have the volume that we decide together, the shape that we decide together, and perfect results. But it's important to know the contralateral sides. In fact, this is important.
Yeah.
If you are honest, you teach your patient, you guide your patient, follow the complication to the right results.
The industry has adapted about the ALCL, and they brought new implants into the market with the microns, the support size below 50, to not to cause but prevent let's say ALCL, which is a rare lymphomic disease, as you said. And don't you think that in the future it might be possible that maybe in 10 or 15 years the industry, because of the doctor's demand, will go, let's say, more about textured implants, but maybe, let's say, below 50 microns. They're not going above. But I can imagine, because of revision surgery, reconstruction surgery, they need to have a little bit a kind of grip.
Yes,
correct?
For sure.
Because otherwise you have the risk of turnaround and all this.
Completely agree with you. Yeah. It's important to divide is for reconstruction or for aesthetic surgery. This is completely different approach. The future for sure will be surprise us, but I think that now we are in the moment that the company study every single aspect for the future. Because after this disease was a game changer, thinking about the breast implant. Then we must wait, we must calm, we must study, and we must discuss with our patient benefit and complication. But for sure, I agree with you about this position for reconstructive surgery. It's important to have a grip, not for aesthetic approach, but the future will show us.
Giuseppe, we have been talking about a lot of interesting topics already, about your career, how you started, how many studies you have done, about your techniques, clinical experience, education from cadaver workshops, the future. And so let's close this podcast with a slightly more personal and forwarding-looking question. How do you see us as ALBIN Group strengthening your collaboration going forward, and what kind of topics or projects would you be excited to explore together in the future with us? How can we support you as a surgeon? What would you like? What do you expect from us?
Look, I use, for example, your implant, in general this implant, from many years. But when I start to use here in Switzerland, I start to meet your staff, Salvatore, for example. And I found an important thing that is so rare, that he doesn't want to sell the product, he wants to create a partnership, a relationship. And the same with you. This is so important, and I appreciate a lot that ALBIN Group work to create an academy of specialists to offer not the product that you have, that your company has, but the knowledge behind the product. This is so important for me, and I appreciate a lot because it's very rare in this market that we are in front of. That ALBIN Group is so special, not just for any. You can just to be honest.
I understand. Yeah.
And my opinion is this: that ALBIN Group start to create this academy to work with a top doctor and to offer to the other doctor the opportunity to increase the knowledge without any other second target, just to offer a right way on the market. I appreciate a lot this project.
Giuseppe, this is something very interesting that you explained me before we started actually with the podcast, and I'm very honored and happy that you would like to organize this with us, and I can fully confirm that we will step into this, because I'm very much interested to organize future ALBIN Academy with such skilled doctors with you, and maybe also, of course, other colleagues. I'm sure that we will also organize with you then together through your experience and through your knowledge, happily also cadaver workshops in the future. Thank you for giving us the opportunity to work so close also with you. And Giuseppe, we have had now 2 sessions of the podcast, more than 30 questions, a career that proves what is possible when scientific rigor meets artistic visions. Thank you so much for your time, your honesty, and your extraordinary contribution to your profession. For our listeners and viewers, this has been ALBIN Group Excellence Podcast with Dr. Giuseppe Colombo. Thank you for your attendance. Thank you also for looking at this podcast, and we are happy and look forward to seeing you next time. Thank you very much, Giuseppe.
And thank you to you, Lou. And thank you in particular for your vision, because we discussed before about this, about the academy and the power to share the knowledge with the other colleague. We discuss with Federico, with Colette. They are top doctors. And this is beautiful, in my opinion, because
Super.
if you create something special, you can leave something special to the other doctor, to the future, to your sons, for example. And your vision is my vision.
And this is just possible because we work with such skilled doctors together, that we have such a beautiful partnership. Thank you very much for supporting us.
Thank you.
Thank you for being here. Thank you for your private time that you have been spending coming extra from Lugano for this podcast. I very much appreciate, and we will support you any way we can. Thank you so much.
Thank you.